Hande Hanım, hello. I would like to thank you for joining us today for this interview because many people asked us about COVID-19 and many people asked us to see you in this interview because we believe you, we trust you, and we know everything about COVID-19 from your interviews. Now we would like to see you like this from this video interview, and we prepared some questions, very interesting questions, and most of these questions were asked from our subscribers. Can I begin?
Absolutely, yes. Thank you for having me.
That's okay. Just the situation changed very dramatically, and every day the number of new infections sets a new record. The number of deaths is increasing, and the doctors are already struggling to cope with patients. What, in your opinion, is the reason for this, and what needs to be done to take this situation under the control?
Emine Hanım, as we all know, this problem started almost about a year ago. And now we are almost at the end of the first year. In the first 6 months or so, we had few cases, but we were always saying this is going to increase exponentially because one person is infecting more than one person. So if one person infects two persons, it's doubling every other day. So now, as we enter winter, and we're getting closer to 1 year, end of 1 year, it's inevitable that the numbers are increasing. First of all, there are more numbers of people in the world who has the possibility to infect others. So when you have higher numbers, you will end up with even higher numbers. That's mathematical. But the second thing is we noticed that this disease, similar to influenza, has also a seasonal character. So in other words, it gets a little bit milder, it gets less. We have fewer cases in the warmer months, but we have increased cases in the winter months. So as this hemisphere has entered winter, after September, we have seen an increase in these numbers. Similarly in Azerbaijan, we have seen an increase in Europe, and most of those countries have actually experienced a much more severe second wave, as we call it, than the first wave. This is happening everywhere. It's happening in Azerbaijan, and what the countries are trying to do is, using all our power to actually try to decrease that speed of increase, because we cannot decrease it totally right now, it seems like, unless we have new options, which vaccine is one. I'm sure we'll talk about it later, but this is how it's going to be. And unfortunately some European countries are in the top 10 in the world in terms of increasing of numbers.
The second question is like this: how quickly the infection is being speeded today?
We have numbers like reproduction rates that tries to explain how quickly the infection is spreading. And the latest that I know, it's around 1.1. So each one person is infecting 1.1 person, or 10 people infect 11 people. So that actually grows. But as I said, you have the numbers. We can say that it's increasing very, very rapidly now. Now, if you look at Azerbaijan, we had around 200 cases in October, mid-October, daily new cases. In about 2-3 weeks' time, we reached from 200 to 2,000. And then we reached around 4,000, close to 5,000. And now we stayed there for a while. The number plateaued around 4,000. And now we are seeing a slight decline in the numbers in Azerbaijan. So we can say, each country has its own epidemiology, and it depends on what measures are being taken, really. So Azerbaijan has taken more strict measures, and we are actually seeing the results of that. And that has been consistent everywhere in the world. Whichever country applied those public health measures, they saw a response. Now, the response was proportional to the width, the breadth of those interventions, the package of interventions. We just saw that things are working, some interventions work, but the trick is to use them, as a package and not pinpoint one intervention as the best. There is no best intervention. Even with the vaccine, we're going to have to use the whole package for a while. So the infection is spreading rapidly now, but we have the measures to calm it down, even if we are in winter.
Could the coronavirus be transmitted through drinking water and...
Yes, that's a good question. In the beginning of the pandemic, there were more questions and more worries about that. And recently, we have had previous reports from countries like China, Germany, Netherlands, New Zealand, where they have isolated virus on the packaging of frozen food. Okay? And this is a rare event. This is an isolated and rare event. And we are still working with experts to see if that has an impact on virus transmission. And what we know that COVID vaccine can survive on surfaces for different lengths of time and depends on temperature and humidity. And under cold storage conditions, also the virus can spread. Now, what's important at all times is people who work with food, who handle food, they have a safe working environment and they follow the safe food processing and handling guidelines meticulously at all times, not for COVID, okay? And there is guidance on that with the Food and Agriculture Organization and WHO. They have worked together on that. So far, now this is the bottom line, so far there is no evidence of people getting COVID-19 from consuming food. So COVID-19 is not a foodborne illness, okay? And since we have not yet detected COVID-19 in water, in drinking water either. So COVID, as far as the evidence goes, it doesn't spread by food nor drinking water.
That's okay. And taking into the consideration of the experience of other countries, is it possible to predict how the epidemic will develop further?
Well, it's really very hard to predict. I must start by saying that. Because now we have a vaccine. However, we don't know how effective it will be on different age groups or occupational groups or vulnerable groups. They are very promising. And, some countries have already started vaccinating. So this actually, we're hoping it will be a significant effect in fighting with this pandemic globally. However, we are going to have to wait for a bit longer for it to show its effects. When a car is going over a certain speed, right? When you're going over like 80, 90, etc., compared to when you're going with 50 or 30, it's going to take, even if you brake very hard, it's going to take a longer time for the car to stop, right? So we are now going, full speed on pandemic right now. Even if we push the brakes with the vaccine plus all the other package, it's going to take us some time to slow down this increase. And honestly speaking, I don't think we will see a significant decrease, not in Azerbaijan, globally, in the coming 3 months. I think we are going to have to work with these public health measures, more strict, less strict, watch the numbers, watch the economy, because it's livelihoods of people also. It's, of course, we are trying to save people's lives, decrease deaths, decrease severe disease. But in the meantime, we know that many people have to work daily to get their, daily bread home. So that's also a very, very important thing when, you don't have proper shelter, you don't have food on your table, you cannot really speak about health. So all the countries, they are trying to protect health and also save the economy to an extent, because we already know that this pandemic has caused significant loss of wealth in some people, some families, and some of those families have actually been, they have lost a lot of wealth. They have fallen into poverty. So it's very important. Now, again, coming back to your predictions question, I don't predict that we will be able to finish this disease in the next 3 to 6 months. That will not happen, most probably. But if we continue, using all our efforts, all our tools, all our weapons, I'm sure we will be able to control it to a degree where we will be able to live more or less normal lives, or as we call a new normal.
In what countries the current epidemiological situation is worse, by your opinion?
As we already talked about, the numbers of cases and the numbers of deaths are increasing, both in numbers of new cases, but also numbers of deaths. And the region that has gained the greatest proportion is the region of the Americas. European region has reported the highest number of new deaths in the past week. I think you want to know the country names. I have to look at the names of the countries, but we know that we always have in the WHO website the 10 countries with the worst situation. We know that United States is.
And what about Azerbaijan?
Azerbaijan, it's because it doesn't have as many people living in Azerbaijan as US, we cannot really compare in absolute numbers. But Azerbaijan is, I think, relatively doing well. And in terms of deaths, also, it's in a better situation than many countries in the world. So I think we can say safely that Azerbaijan has more or less been very successful in adapting their interventions to this disease, starting very early in the pandemic. However, this actually might have caused a certain level of pandemic fatigue in the people, because we have been hearing about these measures since early March, starting with the school closures. So it's a very difficult situation for the people also. They have had to stay indoors during summer, and now we are also having stricter measures in the country. But we will go through this. We will pass this pandemic. Okay, it will be finished. We just have to
we have to follow the rules, very strict. Yeah, we have to strictly follow the rules.
We have to follow. Yes, we have to do it for ourselves, for our loved ones, for our families. We have to do this. There is unfortunately no other way, and this is the new reality. So there is, whatever we say will not change this. So we have to bear with this. We have to go through this. We have to be in solidarity with our neighbors, with our families, with our parents. This is what it is. It's like a common war. This is a war. It's a war, global war, against a common enemy, and we have to get together.
Is there a real coronavirus vaccine in the world?
Okay, good question. Yes, the short answer is yes. What we know is there are currently over 210 vaccines in development, in some stages of development. People already have heard about different phases of vaccine development. Now, vaccine 1 is when they have it in laboratories. Vaccine 2 is a very small number of people are tested for safety mostly. And phase 3 is when you have thousands of people tested, like they do in blind tests, like nobody knows if they are receiving the vaccine or a placebo, and then they compare the results. Now, currently, there are 52 candidate vaccines in human trials, okay? And about 13 of them are in phase 3 trials. Phase 3 is the last phase before the vaccine is marketed. And there are several others. So this is a very robust pipeline. That means the more candidates we have, the more opportunities we have for success. So, and the first phase 3 trials of vaccines started in July. So it's already more than 6 months. And we are hearing from the media that at least 3 vaccines have been tested in some, have started applications in many countries. And we are going to see more and more results from, the outcomes of those countries. Yes, and they are, real. They have very different technologies. Some of them are traditional technologies, some of them are newer technologies, and they are being tested. They are real vaccines, and we as public health professionals are very, very excited about these developments, because not only will these vaccines and new technologies be useful for COVID-19 disease, but we are hoping that the new technologies will be able to translate it into production of other vaccines to save millions and millions of lives in the world.
It's very, very interesting conversation about COVID-19. Punitive measures for breaching the quarantine are widely used in the country, Azerbaijan. How effective, in your opinion, are fines and other punitive measures as a means of combating coronavirus?
I can safely talk about public health measures. All the countries in the world are applying these public health measures of, safe distancing, hand hygiene, respiratory hygiene, including masks where appropriate, good ventilation of closed spaces, and now comes the vaccine. These are the 5 public health interventions we have in our package right now. Okay? Now, countries change from culture to culture, from how much they trust their government traditionally, or not, how much they follow advice, how much they trust scientists or not, and generally how much trust they have to figures of authority, to figures of government, to the media, etc. They change. We know that some European countries do not have that type of trust relationship with the government. I was listening to a French philosopher the other day on TV, and he said, French people traditionally have not had a very trusting relationship with the government. Whoever is in power, the majority of the people are in opposition. So this is a culture, and in that country, it changes a lot what you have to do to make people follow public health advice. As opposed to, for example, China or some Asian countries where people were already used to wearing masks even before COVID pandemic, and they are more used to listening to advice from the government, etc. So it's really going to change according to which country you're trying to apply those public health measures. So some countries might need to use punitive measures. Some countries might not need to use punitive measures, and they only need to advise their communities, etc. I think punitive measures will need to be evaluated separately. We don't have yet enough evidence on whether punishment works. But as a general rule of thumb, we know that rewarding works always better than punishment. However, under these circumstances of a public health event of significance like a pandemic, each country and each government needs to decide on the best ways to ensure that the health of the public is best protected.
We have very interesting question from our subscriber. He asks, is it true that the alcohol and tobacco protect against coronavirus?
Well, it depends on how you use alcohol, okay? If we are talking about using alcohol destroy virus on your hands, for example, yes, it does protect. If the liquid contains at least 60% of alcohol by volume, it acts as a disinfectant on your skin, okay, and it does inactivate the virus. This is how it works, but it doesn't
about
work.
Drinking?
Yes, no, that doesn't work. Okay, I mean, you might wish to do it for some other reasons, but to fight the virus, no. Drinking alcohol does not work. Okay, as when it comes to tobacco, we know that tobacco smokers may be more vulnerable to contracting COVID-19 because the act of smoking involves use of fingers. You touch surfaces, you bring it to your mouth, your hands touch your lips, etc. And so there is more possibility of transmitting the virus from surfaces to your hand, to your mouth, etc. So, smoking water pipes, for example, they also involve sharing of some mouthpieces, etc. So it is also an increased risk. So smoking in general is bad, as we all know. It causes cancer, among other things. And no, it doesn't protect against COVID. And we, as WHO, strongly recommend against use of all tobacco products to protect your health.
I want to ask you another question. It's an additional question. Just why people don't want to use masks? How do you think? Your opinion?
Because wearing mask is not an easy thing. That's why people are finding it difficult to use masks. I mean, they are right. It's not an easy thing. You have to cover your mouth and nose, and it has to stay there. If you're using it correctly, you have to cover your nose. It has to fit very snug here. It has to fit snug under your chin. So it does give you a little bit of a restricted environment of breathing. I mean, I remember nobody was used to wearing masks in the community. I mean, when we were working in the hospitals, in the operating rooms, we knew that we had to do that. But I wasn't used to wearing masks in the street, in outside places, in shops, etc. It is difficult, so we have to admit that. It's not an easy thing. But we all choose between risks and benefits. Everything that we do in life, major things that we have to take decisions on, we choose between risks and benefits. So if the benefits are heavier, if you have more benefits, then you choose that option, right? So what can we give an example for that?
I talked to many people, for example, and I asked them about this, and they said only interesting things. Just it's very dangerous for our organism.
No, masks are not dangerous for our health, generally. But there are sometimes you shouldn't use masks. Like if you're exercising, heavy exercising, you definitely shouldn't wear masks. Okay, people, children, young children, babies definitely shouldn't wear masks. Okay, and if you have difficulty breathing, first of all, you should definitely go see a doctor. Okay, and then maybe you might need to refrain from using masks. But for generally healthy people like you, like me, it's definitely not dangerous for health. And they have done a lot of tests. Like what they did is they tested people's oxygen levels in the blood, because that is the thing that that's the thing that we should see a change if the mask is actually protect or stopping our proper breathing. Okay, if the mask is dangerous, if it's stopping our proper breathing, then we should see a decrease in the oxygen levels in our blood. Okay, so they did a lot of tests like that, and no, it doesn't affect the oxygen levels in our blood. So masks are not dangerous, but it is not easy to wear them at all times, and it's not easy to wear them correctly. Okay, I see a lot of people wearing masks now in the streets. This is very, very good. I see a lot of people wearing masks in closed spaces. That's excellent. But I also see people wearing it incorrectly, especially, exposing the nose, which really significantly decreases the use of the masks. I want to say one more thing about masks. We shouldn't think of masks as protecting ourselves. Okay? We should think of using masks for protecting our loved ones, others. Okay? If we can think of it like that, because when you wear the mask to protect yourself, you can say, there is no risk. I'm okay. I don't mind. I can take this chance. But if you think, because you might be infected and not know it and be infecting other people in your home, okay? So, or not in your home, in your workplace, etc., etc. So if you think of it, I might be sick and not know it, so I don't want to infect other people, so I must wear my mask to protect my loved ones. It brings you to another mindset, okay? So, and if we all wear our masks like this in closed spaces, I think then we can understand and accept it better. It's about acceptance, really. If you accept that this is something you should do, even though you don't like it, then we will, use it more and better. Having said that, last word, masks are important, but masks are only one intervention in a package of interventions. So we have to wash our hands frequently, okay? We have to keep our distance with people. We have to wear masks. Okay, we have to ventilate our closed environments, and hopefully, inshallah, when the vaccine arrives, strongly encouraged to take the vaccine. That's the whole package.
Hande, thank you very much for this interesting and very useful conversation. Thank you very, very much.
Thank you, Jamila Hanım. I hope that we have, I have answered the questions of your subscribers and the people who follow you. And I think it's very important to speak to the media like you, because you are the medium that we actually reach people. And you are doing an excellent, great job in spreading the correct information, because wrong information spreads faster than the pandemic in the world right now. Thank you very much.